LC is a 45-year-old female who's returning for anticoagulation follow-up. She has a mechanical mitral valve, so her INR goal is 2.5 to 3.5. She was last here last Wednesday, and her INR was 1.6 on a dose of 5 milligrams every day. She reported missing some doses. So at that visit, her dose was increased to 7.5 milligrams on Wednesday and Sunday, and then 5 milligrams all other days. Today she presents with an INR of 3.7. She denied any changes in anything.
What was her INR on Wednesday? It was 1.6?
Yes.
How many doses did she miss?
She was a poor historian upon questioning at the last visit, but she said she knows she missed at least 2 doses, but she didn't know exactly when. And she hadn't been here for actual follow-up in several weeks from her last INR.
So it had been a couple weeks since her last INR check, so it could have been, she notes at least 2, but could have been more. Not, we don't really know when those were. They could have been the days before the INR or weeks before. Okay.
But she's been consistently stable on the 5 milligram dose. It's just that she's been having some social issues going on with her lately, so I think she's just been stressed. So that might have played into it as well.
What type of social issues, or did she not really want to disclose them?
She didn't really talk about it, but just based on notes, she's been following up with social work here a lot lately. And she has some issues with her social security being cut off, and she hasn't been able to get food stamps, so she doesn't really have much food at home right now.
Okay. Alright, so 1.6 Wednesday, her goal is 2.5 to 3.5. She came in today, she was
3.7.
3.7, okay. So tell me about the INR.
So it is super therapeutic above the goal, but it's within a reasonable range of her normal. So I decided that she could just resume her usual dose of 5 milligrams.
Was she having any sorts of issues, like review of systems wise? Like,
no, she denied any.
So no missed doses. She had been given a little bit extra on Wednesday. So we boosted her on what days?
Wednesday and Sunday.
Sunday, okay. No, any changes in medications or anything like that recently either?
She denied any changes in her medications, but she didn't actually say there was any changes in her diet, but I think that she's obviously been eating a lot less, so that might have somehow impacted it as well.
Eating a lot less. That's due to the social issues that are going on. She's just lacking the resources.
Mm-hmm.
Okay. How about like any issues with like bleeding or clots, anything like that?
She said no signs or symptoms of any clots or anything alarming. She said she has baseline shortness of breath because she's a current smoker. She uses an albuterol inhaler as needed, so she experiences that intermittently on a normal basis, so nothing beyond her normal for those kind of symptoms. And then she said, every now and then her gums will bleed when she brushes her teeth, but nothing alarming beyond her normal.
Okay. So what is our plan going forward?
The plan is to resume her usual dose that she's been stable on of 5 milligrams daily, and then we're going to bring her back to check the INR in 2 weeks, just because she's had a sub-therapeutic and now super therapeutic on the last 2 checks, so just to make sure she's getting back in her stable range.
Okay, I agree with that. Was anything else discussed at the visit today?
Nothing else was discussed.
Did you talk to her at all about like smoking cessation or at all, or?
No, she doesn't really at this time have the resources or really ability to try quitting. Just with everything
Okay.
else that's going on, she's pretty stressed out. She doesn't want to have to
Yeah.
deal with that right now.
No, I think that's reasonable. I think it's always important to, when we have a smoker, trying to not, we always want our patients to quit, but really trying to assess it at each visit is important. So usually what I'll do is I'll try to give them like a gauge, like on a scale of 1 to 10, kind of like where do they stand as far as 10 being they want to quit and 1 not wanting to be quit or not wanting to quit, and then where do they fall in that range, and then I try to assess that every single time so that I can see if there's been any progress, if they're leaning more towards quitting or if they're kind of moving away. And sometimes it gets thrown by the wayside just due to timing issues and stuff like that, but I think it's something to try to work into your practice. But however
just
you
based
want
on her body language today, I just didn't feel like it was
Okay.
the right time
Oh, no,
to try
yeah.
to assess it.
Oh no, yeah, I feel
But
definitely.
she even didn't admit to smoking. I just know she does from her chart, so I had to like prompt her.
Okay.
I was like, any alcohol or tobacco use, and she said no. So I asked, well, are you a smoker? And then she said yes. So
Okay. Anything else that we need to talk about for her? So I think your plan for the INR is a solid one. She'd been stable on the 5, so going back to that dose and then following up in 2 weeks is appropriate.
yeah, I would have liked if there was more time to further assess her medication compliance, but again, like today was just, there wasn't much time for that. But for the future, I want to follow up on just kind of doing an actual med rec with her while she's in the office.
Okay, awesome.